Doing things how we had always done them resulted in the same gaps, the same holes, and the same disparities. And whether it was the initial way that vaccines were rolled out, a year ago, or some of the early lessons from the pandemic, it was when community members stepped in and when we partnered with community. And I'm so grateful that Dr. Ojikutu stepped into this role and now has fully stepped into ensuring that our cabinet has a direct public health voice. We know that we have to follow the lead of communities to meet people where they are, and that you all, as multilingual media, are the front lines of that. So we'll have a more specific plan in terms of how we continuously build into our communications cabinet. Today we just announced our new communications chief, Jessica Pierre, who will ensure that the way that we are even structuring our communications cabinet is different and is focused on prioritizing neighborhood media, grassroots media, multilingual media as well. And that should come with budget, absolutely.
Sure, yeah, so, and you're absolutely right. I mean, when I grew up, I still remember the smell of, and the ink, I mean, I wash my hands, so it's not on my hands anymore, but the ink of the Bay State banner, because that's how I got my information. So you're absolutely right that our communication channels need to be prioritized and how we get this information out. I know it's a priority for us. And then in particular, in terms of making sure small businesses get a piece of the pie, I think is what you said, right? This is going to come through the partnerships that we have as well, not just the programming that we put in place in the initiatives, but who we have these strategic partnerships with. Again, coming from an advocacy organization that pushed to make sure that our businesses were getting contracts, I know that the way to get that is to partner with organizations like yours, or Beck might have about Latinx, others, because they know who those businesses are. And so when these opportunities are available, it's working with those organizations to say, here are the opportunities, let's make sure your members get access to them, let's support them as they bid on these contracts and ensure that we're hitting our goals.
Bigger question. Why not a negative test option? Dr. Ojikutu said that this is not for the people who have already been vaccinated, but the other 30% that made a choice not to do so. My son is 18 years old. He has not been vaccinated since he was 2 years old. He recently got a job at a venue in Fenway. He can no longer move forward with onboarding because from 2 until 18, I made the choice not to vaccinate him. And now at 18, he don't want to be vaccinated. So it's either money or a choice that he does not want to make. What about the people who currently work at these venues? Are they now unemployed? And how will they be compensated? What about the people who, for instance, my sister has a health condition. If she gets vaccinated, she will die. It's in her health records. Don't even ask her if she wants it. She can no longer come to my father's birthday party because it's after the fact. She won't be allowed in the venue. If they have an outdoor space, can I still go inside in order to go to the outdoor, or is it going to be no? It's a slippery slope. We're talking about May here. We're talking about May of next year, of making 5-year-olds get a vaccine when parents are making the choice not to. So this is a slippery slope to now daycares are like, I'm not receiving a child that's not vaccinated. So either my child doesn't go to daycare or I have to go find somebody that will take him. And that's slippery slope, that's the future. It may not be right now. Another question. This is stupid, but at the same time, for someone who paid for a yearly gym membership, are they gonna get reimbursed from the city? Dumb question, but serious. Companies that say, this is fascist, I have a choice. As a business, I do not want to mandate people to come in here to be vaccinated. What are they going to be fined? Because I sat here for the last 10 years and talked to City Hall. We can't make businesses hire and sustain black people working for them. I can't force public housing to do X, Y, Z, but you can force me to make a health decision? I'm confused and I'm angry and I'm upset that you're taking away my options. Dr. Ojikutu, as far as these numbers are concerned, people are dying. My friend just died of COVID. He was vaccinated, boosted up, masked up. People are still dying, yes or no, after being vaccinated. The vaccine is not the end-all, be-all, cure-all. Does it help? Yes. But if you're vaccinated and it's supposed to protect you from me, the unvaccinated, how are you gonna force me to get vaccinated? I'm not understanding how, it doesn't add up for me. Last question is I would like the numbers. Dr. Ojikutu, you said if. There was like 3 different ifs in there, so it's like possibility. So I would like the numbers of who in the last umpteen have died of COVID that were vaccinated and that died unvaccinated.
I'll just say this is a moment that we, as a society, haven't seen in like 100 years. The last time we had a pandemic and millions of people died around the world, we have lessons that we have learned from then, and we have the ability to affect those numbers even day by day right now. And so I know it's really hard, right? I have 2 boys. I have to think about what it means when I'm putting them in situations where they don't have full control, and it might have an impact on the rest of their lives as well. We have to make sure first and foremost that they have a chance to be part of the world in the future as well, that they can be safe and healthy and alive and part of this community. We're not trying to force anyone to make a decision that they, for their own personal reasons, can't make or don't want to make. And there are medical and religious exemptions still built into the policy. So for your sister, I believe, or your relative, for example. There are also many ways in which this policy is designed so that people can still and have to still be able to access the daily necessities of their lives, right? As Dr. Ojikutu was saying, nobody is barred from going grocery shopping, from doing things that are not as high risk indoors. But for eating inside, for going to a show, for going to the gym, in this moment, this is still a public health emergency, and so we have to take those actions. We're doing everything we can on the other side as well to set up outdoor dining so that nobody would be asked for proof of vaccination to eat on a patio outside. So we're working quickly to make sure that that's all ready to go, and there's jobs available for that, and that we can provide every angle of trying to keep things going. But the reality is that if we do nothing, we will have to shut down our businesses, and many of these jobs will go away once again. It'll be like a year ago. So we have to act differently now that we have the vaccine, and this is the best way to make sure that we can still keep living with COVID as a society and as an economy.
So first, I want to say that I understand where you're coming from. I have friends who have not been vaccinated. I listen to them. I spent most of my time before becoming the executive director talking to people, trying to encourage them, but also meeting them where they're at. Understanding that mistrust is normal and rational in the world we live in. You know, given all what has happened to people in terms of structural racism, the ways that institutions have treated people, that's rational. I do understand that. But what I would say is that we're truly in a state of emergency. And I've asked that friends, family members, anyone who was hesitant, just wait and see, but eventually you gotta get vaccinated. At this point, nationally, in terms of safety, more than 500 million doses of COVID-19 vaccine have been given out, with very rare side effects and mild sort of after effects, as you know, probably read, pain in the arm, some muscle aches, slight fatigue, those sorts of side effects. So at this point, we feel that these vaccines are safe, and we also know that they're effective from very large clinical trials and from data that's been collected over the time since these vaccines have been under emergency use authorization. So in terms of the actual numbers, if you look at the cases here in Boston, probably 2/3 are amongst people who are unvaccinated. If you look at hospitalizations statewide, more than 2/3 amongst people who are unvaccinated. And these are the people who end up dying. In a large study done by the CDC, they looked across numerous states. Essentially what they found is that if you are unvaccinated, you are around 10 times more likely to be hospitalized and around 10 times more likely to die. Those data have been published widely, and it's true. I mean, it's what we're seeing in our hospitals. So what I would say is that we have to follow the data, and we have to realize that we're truly at the point where we need to encourage people to get vaccinated, to not only protect themselves, but to also protect our infrastructure, our communities, and to protect our ability to stay open as a city. The reality is that I don't see COVID going anywhere soon, right? You're nodding your head, so I don't see it going anywhere. We're gonna have new variants. There's gonna be Pi, Sigma, Rho, we're gonna have new variants, particularly if people are unvaccinated. We have to learn how to live with COVID. Our hospitals have to stay open. We have to be able to go to school. The way to do that is to get people vaccinated. And that's honestly.
What about choice? I haven't heard either one of you speak about choice. It's my choice. I'm not getting vaccinated. It's not going anywhere. I am going to get it. I already got it. I'm going to get it again. Just like you get the common cold, just like you get the flu. I don't get the flu shot either. I've never had the flu, ever. But I've never had a flu shot. I want to hear about choice and the ability to have a choice while being a Boston resident.
Well, I can say that the way that this policy was written, it doesn't exclude people from activities of daily living. It really doesn't. We're talking about places where we know people will unmask.
Now if it comes to Boston, I can't see Nas. I want to go to dinner. I can't go to dinner. That does prevent me.
Right.
So
right.
Can I pick one example? So I think there are lots of ways in which we have put other protections in place that do restrict people's choice at the moment that they, like, if you're in your home, I'm not talking about you, but just in general, we're in our home, we're not interacting with the general public. By all means, the government's supposed to stay far away from that, not do anything in there. The moment you get in your car, even if you are claustrophobic, right, you're supposed to buckle your seatbelt because that is going to keep you and the rest of your passengers safe. The moment that you set foot into a restaurant, you're supposed to have shoes on and clothes on so that you're not, causing unsanitary conditions in the restaurant. Or in a lot of places, we're not supposed to bring pets inside except for limited exceptions because it can cause other illnesses that will then affect other people. So this is really about the ways in which we are interacting with each other. It's not about limiting anyone's individual choice, but the moment that anyone's choices in any way, any of the seconds that make up your day start to touch other people, that in an emergency, that's where we have to start putting some parameters in place.
I think that we need to move on.
Jean-Claude had a question.
Oh, sorry.
Oh, if you have something else before, it's fine.
She had raised her first.
Okay.
Yes, thank you. So there is the Boston Asian radio and TV station, and together with 播全中文网, it's like a Chinese platform, and we want to stand on the perspective for the students in Boston. And first, we want to clarify that we support the new policy because of we think vaccination is definitely a great choice for all the citizens in Boston. But standing on the perspective of foreign students, maybe they took the fully completed the vaccine, local vaccines overseas, like Sinovac in China or Sputnik in Russia. So for these foreign students, do they need to 2 doses in Boston, or they need just 1 booster, or they have any other rules for them to define them as fully vaccinated in Boston? Just curious of this specific detail. Thank you.
So that's a great question, given the diversity of our population here in Boston. So the CDC has made recommendations in regards to Sinovac or AstraZeneca, which are vaccines that are not available here, but that other people have gotten and finished and completed their series elsewhere. If these vaccines are approved by the WHO, the World Health Organization, then they are acceptable here. People should be boosted, and the CDC has recommended that they receive their booster dose 6 months after the last dose, similar to what we do here, what we would recommend.
So if they want to take the booster, just like not to 6 months, like they come to here for school, right? But maybe the month is not long enough for like the 2 doses. Can they take booster? Because I come from like Boston University, and the CVS near my school just defined the students in Boston University cannot take a booster because we have fully vaccinated in China now. So like we cannot take 2 doses in the United States. Like they have the rules for that. So I'm not sure like for after the new policy, can we allow to take like 2 doses in Boston, or just we are like banned from the.
If you're defined as fully vaccinated, and those rules are defined by the CDC, that's 2 doses, and as I mentioned, it includes the doses that are related to the vaccines that have been approved by the World Health Organization, then that fits within our policy. That doesn't, as long as you're meeting the requirement of that fully vaccinated definition. I would add, because I think it's very important, that boosting is incredibly important, specifically if we're, in the setting of the Omicron variant. We have not adjusted our policy to include that booster dose yet. Once we get the guidance from the CDC regarding that, we will add that to our policy. Hopefully that helps.
It wasn't long ago that Russell Holmes stated my pen was among the lowest vaccinated area in Boston. Among the ethnic groups, I know messaging is very, very important, but who are the messengers is also very, very important. Will you be seeking upon delivering these messages via the right channels, or are you maintaining the same old mainstream of systematic that has been there forever and that hasn't really gotten into us? That's one. I got a phone call this morning. Your free testing areas, people are just lining up and tied up 1 hour, 2 hours, or 3 hours waiting time. I had a friend of mine who had traveled just throughout all over Mass to see whether if he could get a test done. And the timing was just outrageous. So he called me up thinking that I might have some connections to get him through. But I told him, unfortunately, I don't have any, because I had to wait in line to get mine too the other day. That's 2. And number 3, upon doing all of these changes within this big building, I know that there are some old leaders who are still in here and who's probably not willing to adjust to the new mayor. How are you working together with them on that end? Because there are some of them who are so reluctant for changes of the new coming administrations. And how are you overcoming that? Because I know there's a hurdle on the way. So, hoping that you're gonna be able to.
Well, I'll take 1 and 3, and then maybe Michelle can jump in on 2. In terms of the messengers, we hope you all will help be part of that effort. I know the PSAs, the public service announcements that happened in the first wave of vaccination were incredibly effective, right? La vacuna salva vidas, which we did multiple times with El Mundo and all of the videos that were put together, community by community. You're absolutely right that some of the posters that were in different places around the city with known, trusted community leaders as part of that. I think we, especially around boosters and child vaccinations, we are needing to move in that direction. So any suggestions on messengers, using your outlets and using the platform, let us know. We can send cabinet chiefs and the department heads on. We can ask community members to be partners, but this is the moment where we need to keep closing those gaps. And then in terms of moving to a new way of doing things, in a big organization, 18,000 employees in the city of Boston, it is a big ship that can turn slowly. But I think the beauty of city government is that there's always something small you can do that adds up pretty quickly. And so even with the appointments that we've made, the new leaders who have joined and brought incredible energy into City Hall and this administration already, yes, there are, even since Monday's announcement, even from within the organization, there are some conversations conversations that we're still having, and we are trying to make sure that it is about calling people in as much as possible, right? So we're having weekly sessions with each of the departments for anyone with questions about how our own workforce policy and the vaccination policy fits. We're doing more live streams across all of the city workforce, because it's the same thing as reaching community members, is that reaching past department heads and supervisors to our frontline city staff is very, very important to changing the culture of the organization. And so we're using the same methods in some ways to connect and to bring people in that way. Want to talk about testing availability?
Yes, and I would like to also mention, you're absolutely right, Mattapan as a neighborhood has had some of the lowest vaccination rates across the city, but most recently, the neighborhood went above 50%. So that was a major accomplishment. I think that's largely due to work, community-based work, and people in the community, faith leaders, community organizations, people who are just key stakeholders, key opinion leaders within the community. We actually engaged them through our Vaccine Equity Grant Recipients Coalition. So we meet every other week with folks, including a number of folks from the Haitian community and people who are working in Mattapan, which has been incredibly important to our overall work. So definitely people are at the table, but I would love to hear if there are people who are missing from that table, and please just let us know. So in terms of testing across the city, I have to just be very clear that, and I would say not just across the city, but across the state, there's a lack of the PCR testing, right? So there's the PCR testing, and there's the rapid antigen testing, and I told you about the rapid antigen testing kits. So the standing testing, the PCR testing, it's in limited supply right now. We are talking to the state to try to get more sites open, and as soon as I know more, I will let everybody know. I mean, this is something we're definitely advocating for. In the meantime, we want people to have access to these rapid antigen testing kits, and like I said, we're putting more out there for people to access, particularly in neighborhoods where there's lower vaccination rates or higher positivity rates. So that's one of the things that we prioritize in terms of access.
So what of advice, Mayor, often your staff will say, well, why don't you consult the website? And you talking not to a full world that understands the meaning of it. So please, the assets of the ethnic media, if there's a connection that could be made through them to channel this information out there, I think it'll do much better than anything else.
I'm sorry, you.
Hi, I am Andrew Sharp from Caribbean Diaspora Connect. I endorse the mandate because in the Caribbean we are used to vaccine mandate. I had the privilege of traveling other states, and I just, about 3 months ago, I just came back from Washington, D.C. Seattle, not Washington, D.C., Seattle, Washington. When I landed in Seattle, the first thing that appeared on my phone was an app to download to notify me. It's the Washington Notify app. Is the city looking at developing that similar app for the city itself in terms of notifying you where hotspots are, being able to provide information on where clinics are located, where testing points are located? Since whether we like it or not, we are transitioning into a technology world. Things are advancing, so will we be looking at having that streamline of information on an app so that persons who are technology driven, which is about 60% of the population, will be able to look on it just like what Washington has done, Seattle, when I went to Seattle. So I could have seen, if I'm in a room, we know that, we can identify persons who have not. Information is provided on that. I would like to.
Absolutely, and we always need to continue closing the digital divide in Boston and making sure we're meeting everyone where they're at. But I think a lot of the anxiety that's out in the community about the pandemic has been related to feeling uncertain about what the information actually is and wanting to follow along and know how to get where the resources are. And so I haven't said this to anyone yet, but I have been thinking in my head about how do we, once we have our permanent chief information officer identified, really think about an app that could have a lot more resources than just a vaccine proof, because we are going to need it, unfortunately, as Dr. Ojikutu says, whether this virus or another virus, we need to be investing in our public health infrastructure, and that technology is going to be a key piece of it.
Have you guys thought about turning it around from a positive point of view, meaning that if you go to a restaurant now or after January 15th, you will be assured that you are surrounded by vaccinated people. So rather than kind of messaging being, we're not, it's a positive for restaurant small business owners to kind of use that as a pro-marketing tool, saying you are safe in our restaurant now because we have no choice, but everybody here is vaccinated. I was just in New York and that was the feeling I got. Everyone was there vaccinated, so I didn't let my guard down, I still got my mask and everything, but there was a higher sense of security. I think it's a good marketing tool for it.
No, you're absolutely right. I didn't plan that question right away. But the point that I was making on Monday, but also what I've been hearing from small business owners in previous role, is that this helps boost consumer confidence. The best way to support our small businesses is by making it safe enough that people want to go out and support them, whether it be eating, entertainment, or fitness. And so, you're absolutely right. I mean, again, when I was talking to business owners, their employees want something like this to ensure that when people are taking off their masks, they know that it's another vaccinated person. Patrons want to know that all the employees that are working there are vaccinated. And so, absolutely, this is a boost to consumer confidence that will allow folks to be mindful and feel like they're safe when they're in these spaces. So you're absolutely right.
Okay, Mark Neal, Urban Heat. Couple of things. First, I say on behalf of myself, I'm not sure about everyone else here, I'm more than happy to accept the testing kits as well as masks to distribute to the listeners in my community. I'm happy to do that. The second thing is, as the gentleman spoke in regards to media buys, I just want to impress upon what he said and stress that it's important that us as the on-the-ground media outlets be included in the media buys. When you turn on the TV, you're seeing things that's happening in the city of Boston, and for the most part, we're not included in pushing that message out to our people. So, just keep us in mind, as you all move forward when you're making your media buys, instead of, dumping millions of dollars into Channel 5 and 4 and 7, send some of that to us so that we can survive and get the message out to our people as well.
Thank you. My name is Oswald Netron from Oadio Concord, and I am also an ambassador. We have a group of people knocking doors, encouraging people to get vaccinated. And what we found out is most of the resistance comes from the people, from the church people. I didn't hear we talk too much about the churches. Okay, with this vaccine mandate, is it going to be applied to the church? Are you going to find a way to work with the church so more people from the church can get vaccinated?
Oh, sure. So we partnered with a number of churches throughout the Boston community to provide vaccines on site and to do, door knocking, boots on the ground. Faith leaders are an incredibly important voice, particularly within communities of color, and they're at the table in terms of deciding, are the strategies that we're using to reach people. So that's an incredibly important partnership, and we hope to expand that. So if there are people who you think need to be added or who have not been included, please let us know, and I'll just press out my information to everyone, who's here today.
I think we have to end. I'm so sorry. Did you want to share any closing message or in any other language or anything else? Or?
I mean, all I would say to end is that, this is about working together to get through this. I think it's going to be just really important for us to pass the messages on to our communities that we need to not only get tested and wear masks, we need to get vaccinated and get boosted. And if you pass on that message to one other person and they pass it on to another person, we'll eventually get through this together.
And just to add on that, it's incredibly important that our community be vaccinated so that our small businesses can thrive and survive through this pandemic, as well as our workforce as well. So I'm very excited to have met many of you, first of all, to have really good friends in here and future good friends in here, because for me this has been a focus group. All your questions help ensure that our cabinet is being responsive to the needs and the concerns of our community. So thank you all very much. I hope to continue this partnership beyond just this conversation as we move forward.
All I'll say is that you know, it's been quite an intense period since our announcement of this proof of vaccination requirements. I know there's a lot of, as Dr. Ojikutu frames it, there's a lot of emotion that's also tied to misinformation out in the world. Of course, there are valid concerns that each person is thinking through as they're making decisions for themselves and their children. But it was very striking to me that as we were having the press conference in City Hall, surrounded by other mayors and executives and leaders from our communities reflecting the diversity of Boston, a group came in unmasked that was chanting USA, USA, singing patriotic songs with the clear implication and message that those of us trying to come together to protect our communities maybe don't quite belong here the same way, right? It is an illness in our political system nationally right now that people are using fear and distrust to drive our communities apart. There's nothing more American than taking the steps we need to bring people together, to take care of each other. And I want to make sure that the city of Boston is always standing up to be that example of our values as a country, that so many of our families from immigrant backgrounds sacrificed to come here to be part of, and that each one of us not only deserves to be here as a valued member of our society, but is sitting at these tables where important decisions are being made, shaping the conversations, and you all are going to continue to be trusted partners in that. So thank you so much for being with us.
Continue to stay strong, okay? Yeah, no